Hi, so today we're talking to Ziyi and Rethinam, co-founders of PhysioVitae Physiotherapy Center. Now, most people, when they think about physiotherapy, they're thinking about fixing a sprained ankle or a bad back, stuff that we can see, right? But you guys, you actually also deal with the more invisible side of health. Could you perhaps just give us a quick introduction about yourselves and also give us a sense of the scope of the conditions you actually treat here?
Yeah, okay. So let me go first. I am Rethinam. I have been a physiotherapist for almost more than 12 years. I started off in a public hospital and then opened this clinic. So what's unique about us is that we are primarily a cardiopulmonary physio. And what we do is very different from the classic physio that people know. So they actually think that when you have physio, like what you said, it's back pain, knee pain. But what we do is that we look at a patient very holistically. So we look at their heart and lungs and their metabolic functions. And the idea is really to prevent them from even having a chronic condition and manage it well, so that they will have a longer health quality of life and improve their health span as well.
Yeah, so similarly, I've been a physio since 2015. So my main area of specialty is also in cardiopulmonary. So like what you say, most people don't know this area of physiotherapy that actually exists. So to add on to what Rethinam was saying, actually both of us are lifestyle medicine accredited. So that's why we always look at a patient very holistically in the 6 pillars of lifestyle medicine.
Okay, thanks for that. So basically, I think, in your explanation, I hear a couple of terms. So perhaps, could you explain, when you say cardiopulmonary, what you're talking about? How does lifestyle becomes a medicine?
So cardiopulmonary, basically, as the word suggests, cardio means heart, and then pulmonary means the lung. So these are the areas that we specialize in. So common conditions that we actually see are patients, let's say, post-heart attack, they had a stent done, or even those pulmonary conditions like, for example, a smoker, he develops this thing called chronic obstructive pulmonary disease, where eventually they start feeling breathless, they produce more phlegm. So these are areas that we, physiotherapy can help in this group of patients.
So maybe if I were to add on the lifestyle aspect, so let's just say if everyone knows what we do as a physio is like a back pain, knee pain, but if underlyingly, if you actually look, how does this even come about? It's actually because of poor lifestyle habits. So even someone who has a poor sitting posture and they sit in the office for long periods of time, that makes them susceptible to neck pain and back pain as well. And even someone who may have an ankle sprain, that could be because of poor habits of they have not exercised appropriately, and as a result transited to a very high intense kind of sports, and as a result they had a sprain. So when I translate this in terms of chronic conditions, when we look at lifestyle aspect, we're actually looking at how they actually sleep, what they actually eat, how they actually even exercise the intensity, any stresses in their life. We also look at their habits, like maybe do they smoke or drink. The last one, which is often forgotten, is really looking at their social connections. So this is how we look at every condition, not just as the disease itself, but actually what's the contributing factors to it. And very much often it's actually the person themselves, which entails actually their life. And that's how we actually bring about this whole aspect when we manage a patient. Yeah.
Social connections, that means like my friends.
Of course.
So my friends can be affecting my health.
No, so a very famous Harvard study actually has proven that they did to analyze someone who has a good quality of life, or how they actually had a good to be disease-free, actually was primarily based on because of them having good relationships with their partners, spouses. It could be also because of their friends, a social network that they may have towards the end part of their life. So that actually creates a very positive environment. A very simple aspect of, when we, in the community centers in Singapore, they try to create these communal aspects of how people exercise, because that gives you the togetherness. In a very simple aspect, when you are all in the same aspect of going through a condition, for example, maybe you're all a common goal of losing weight. If you are like-minded people, that's where the positivity comes in as well. So that also improves your overall empowerment to even take care of your health as well. So that's why the social connection is often sometimes forgotten. And sometimes how we do emphasize this, we look at a patient in their, do you have any friends whom you can bring along to exercise? Do you have any a network of a group of family members whom you can bring along in this journey? So we actually even look at this aspect as well. But linking back to the aspect of what physiotherapy is in the cardiopulmonary, I think very often people just forget that you should not only be seeing or seek help or when you have an injury. In fact, you should even seek help before you reach to the end stage. Like for example, you should be actually even seeing how you can take care of your diet, your exercise, your sleep before you even have actually a heart attack, or when you have the first onset of a health screening that picks up maybe you have a high cholesterol. So these are aspects of which we as physiotherapists or cardiopulmonary physio, we are very much trained to actually bring about the empower patients to manage this aspect of health. Yeah.
Just now you mentioned about heart and lung specifically. So could you tell us a little bit more about the types of heart and lung diseases that you see most often here? What does a typical medical patient that comes here, what does he or she look like?
Yeah. So most of the time, the cardiologists actually refer patients post heart attack. So once they get a heart attack, they actually either do a stent, or they might go through this procedure called a coronary artery bypass graft surgery. So most of the time, after these patients go through these procedures, the first question that they always pose to the cardiologist is, how can I start exercising again? So they don't know where to start. So that's where we are the experts in this area of rehabilitation. So what we see is we always bring these patients through a very graded kind of exercise progression. So with the eventual aim of getting their heart to be functioning better, so they can feel less breathless when they are doing their activities of daily living.
So when you say graded exercise, what exactly does that mean?
So that means usually when they come to us, we'll do an exercise testing with them to see what's their baseline function after the heart attack or the cardiac event itself. And then from there, we can actually start off with very low intensity exercises. Of course, we have all our safety protocols in place. That's why this is medically guided kind of rehabilitation. So as the weeks pass, a typical program usually lasts about 8 to 10 weeks. And then with each week that passes, we will see how their function is improving. And if appropriate, we will increase the exercise intensity week by week to a level that is appropriate for the patient.
You would think that for a lot of these heart attack survivors,
Yep.
right, they would actually be worried about exercising too vigorously. Is it better for them to rest, or they really should get back into an exercise regime, an appropriate level, as soon as possible?
Yeah, so we always do get that question a lot. So the correct answer is they should start exercising, of course, under medical guidance. So the reason is because sometimes post a cardiac event, the patient's heart function actually decreases significantly. So even doing simple chores can get them breathless. So hence, this group of patients, they actually need even more rehab to build back their heart strength. So think of the heart. The heart is a muscle. So with all other muscles, you need a bit of strengthening, a bit of conditioning to get stronger. So similarly, the same concept actually applies to your heart. So that's why post cardiac events, patients should actually undergo a very structured, supervised kind of cardiac rehabilitation program.
And in terms of lung disease, so what kind are we talking about? Lung cancer, or what kind of lung conditions would benefit from physiotherapy?
So actually, for lung conditions, there are a wide variety of conditions that typically we manage. But one that has prevalence that is really it's critical is a condition called bronchiectasis. So where the lung has actually a phlegm buildup, or it lacks the ability to clear the phlegm naturally. So this is where physiotherapy plays a pertinent role on top of course medications and doctors managing them as well, because we can actually put them in a particular positions on the bed and get them to do techniques to actually clear their phlegm easily, and this actually reduces the disease burden as well and them having recurrent infections. So that's one condition. And I think of late, people have been who had COVID before. The prevalence of long COVID actually is existence as well, and that causes them to be very breathless. So we have the ability to be to actually allow them to exercise, while at the same time, even though they're symptomatic, to actually allow them to improve. The third thing is, of course, there's also other conditions where some patients, they feel extreme breathlessness, and that also limits their day-to-day activities, allows them even, it's very difficult for them to do anything that is even exercise in the first place. So what we have the ability to do is to really be a bit more gradual in their exercise, and as a result, eventually be able to even do the basic things of their ADLs like showering and all that. And this is a prevalent thing that happens with, as what Zia mentioned, people with COPD, where they previously may have history of smoking and some changes to their lungs that may have happened. The last one, you did mention something about cancer as well. So in the aspect of cancer, if sometimes patients before they go for surgery, they may be a bit more frail, we can actually do rehabilitation to optimize their overall health, to prepare them for the surgery. And post-operatively, there's a very strong evidence where they should go through rehab as well. Like for example, if they go through a lobectomy, where the removal of a part of their lungs, where they should actually optimize their function, their lung function through rehab as well. So that's also a role for us as well.
What's the difference between coming to you guys for physiotherapy or just going to a gym and engaging a personal trainer?
Okay, I mean, if I can add on to that, to the question is, I think the main thing here that we bring in is that we have the knowledge, medical knowledge, to be able to progress our patients who may have underlying severe cardiac conditions, medical conditions that will actually limit them from being able to exercise. I think that's the value we bring in. The extensive years of experience of training that we've gone through and the medical insight on how to manage this group of patients. I'm not saying that physical trainers, they may have some level of knowledge to do it, but there will definitely, and that's where our training comes in physiotherapy school, where we have that ability to infuse medical knowledge and physiotherapy practice into the way we manage our patients. Yeah,
I think most of the time patients want that safety assurance, especially after a stent or after a surgery. So what we do here is actually we put them on cardiac monitoring, for example, ECG monitoring while they are exercising. And then we also have safety protocols like our AED and all. So patients feel assured that they are being monitored by somebody who is medically trained. So that's why we also know how much we can push the patient based on all the objective feedback from the ECGs that we are getting during our session itself.
If I may add on, there's also a forgotten group where people actually forget that people with diabetes, actually, we can actually also manage them as cardiopulmonary physios. We forget the metabolic conditions, which I will elaborate later. But for diabetes, for example, sometimes patients struggle to exercise because they have that low glucose levels, where they feel very giddy, they can't exercise because their sugar levels are low. So how do we then guide them to exercise without going into such episodes? And that's where that medical knowledge comes in, and us being able to interpret their glucose levels and when they're having this low glucose, or what do they need to do before the exercise, is where we can advise them. Also recently, I think there's been a significant hot topic about the sarcopenia as well as as osteoporosis. So osteoporosis is very prevalent in our Asian population because we tend to be vitamin D deficient as well. So there's another group of patients under the metabolic umbrella where we can actually manage as well. So, and sarcopenia, because as people age, when they become more sedentary, lack of mobility and lack of proper nutrition, it predisposes them at higher risk of sarcopenia as well. And this is another group where we are able to actually manage them. And how do we do that? I think overarching, we do have in-body machines where we can assess them as well. We pay a bit close attention to their nutrition as well and what they take. And I think in the groups that Tzi has mentioned as well, we do exercise testing. So we don't come up with a generic protocol. We come up with a protocol that is based on each person's ability and gradually progress them to achieve the outcomes that we want them to ideally achieve.
If I am hearing you correctly, one critical difference that you bring to the table compared to a personal trainer is that you are able to medically monitor your patient's condition. So you've got ECG monitors, whereas typically at the gym you would have such equipment. So you would, the personal trainer wouldn't know whether he's pushing the patient beyond what he or she can take. And the other interesting thing also is we're talking about vitamin D deficiency as well as nutrition deficiency, which would sound a little bit surprising, to us, because in Singapore, plenty of sun. Why do we have vitamin D deficiency? And we generally, I think we eat quite well. At least we eat quite a lot. So, how do we end up with nutrition deficiency?
I think it's essentially about, it's not what you eat. See, people, you may be eating well, you may be eating excessively, but are you eating well is the question. Are you eating a balanced meal is the question here. And talking about the sun, contrary, probably most actually people, we don't like to be under the sun, Asians, and that's the main reason why we even have vitamin D deficiency. I think also to add on to that part of what's the difference that we can bring in as well, right, is we have that we understand medications as well. So I think something I would like to highlight as well, patients who post heart attack or maybe a post cardiac, sometimes they'll be on these medicines where it affects their heart rate. Sometimes if you do not pay attention to these medications that they may be on, it may actually be something that may not be able to achieve the outcomes that we would like for our patients. So that's the extra value that we can bring into this group of patients as well.
I think adding on to his point, it's that we work very closely with the specialists. So for all our patients, we always have a like a midpoint and an end review, communication with the specialist.
But I think the key point here is that we really bring in that coordination point where I believe patients also want their feedback to be given back to their doctors to tell how they're doing as well. And I think that's also something that's valued as well in a holistic aspect from the doctors as well. So I think that's something we can bring for that connecting point that may be lacking from a personal trainer.
And if I may also pick up on this point about us having a sedentary lifestyle, I think a lot of us we like to go for evening walks or evening jogs. Is that not sufficient, to prevent conditions like sarcopenia, or do we need to do more?
So most of the time, from what we always see, a lot of patients actually tell us that, actually I work as a delivery job. I walk a lot. I carry quite a bit of heavy things on the job itself. But actually there is a fixed guidelines of how much one should exercise. So at least 150 minutes of aerobic exercise a week, and that the time is crucial, but it's also the heart rate that you are exercising at that gives you health benefits. So for example, a slow stroll, if you're not hitting a certain target heart rate based on your age or for your condition, sometimes the health benefits will not be as great. Hence, that's the area that we can value add in terms of the patient's health, improving the patient's health.
And also to add on, sometimes strengthening exercises as well, appropriate load that they need to carry as well to bring about these muscle changes is also critical as well. And that's something that we can advise our patients as well to do so.
Maybe afterwards, you can share with us some basic strengthening exercises that people can do, to prevent onset of muscle loss, or if they're worried about obesity and diabetes, what are some of the things they can start working on?
Sure.
Okay, so welcome to the PhysioVitae gym. So let me show you around. So we do have a wide range of cardio machines. We have a treadmill, a recumbent bike, an upright bike, and right in the corner over there, we have a ski machine and a row machine. So of course, we do have a multi-gym as well, where we can work with a lot of upper limb and lower limb exercises. And of course, not forgetting our in-body body composition scan. Okay, so for clients who actually do not have access to such exercise equipment, let me show you guys some simple exercises that you can actually do at home. So the recommendation is always to do 1 or 2 upper body exercises and 1 or 2 lower body exercises. So let me start with a very simple exercise called sit to stand. So basically you just need a chair. Okay, so what you can do is actually you can place your hands across your chest and then lean forward and stand. And then after that, lower yourself back down slowly. And then you can repeat this movement for 8 to 10 times. Okay, so try to do this every day, at least 2 to 3 times a day if possible. So this trains your lower limb muscles. So for the upper limb exercise, you basically just need a wall. So this is a wall push-up. So stand about a couple of feet away from the wall, hands outright. And then what you can do is lower yourself near the wall, and then after that, push yourself back up. So similarly, repeat this for about 10 times and do this about 2 to 3 times a day. So this works your upper limb and your chest muscles.